Introduction to mental health. Mental health counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. It involves applying various therapeutic techniques and interventions to address emotional, social, vocational, educational, health-related, developmental, and organizational concerns. Counselors work collaboratively with clients to explore challenges, identify strengths, and develop coping mechanisms. This field emphasizes a holistic approach, considering all aspects of a client's life and environment. It is distinct from other mental health professions through its focus on prevention, development, and client empowerment. The ultimate aim is to foster resilience and improve overall quality of life for those seeking support. Understanding the scope and purpose of counseling is fundamental to effective practice. The role of a mental health counselor is multifaceted, encompassing assessment, diagnosis, treatment planning, and direct therapeutic intervention. Counselors often work in various settings, including private practices, community mental health centers, hospitals, schools, and government agencies. They are trained to address a wide range of mental health conditions, from anxiety and depression to more severe psychological disorders. Professional counselors adhere to strict ethical guidelines and legal standards to ensure client safety and confidentiality. Continuous professional development and supervision are integral to maintaining competence and providing high-quality care. This introductory section lays the groundwork for the specialized knowledge and skills required in the profession. Historical context and evolution. The origins of mental health counseling can be traced back to early 20th century vocational guidance movements, which sought to help individuals find suitable careers. Over time, this focus expanded to include personal and social development, recognizing the interconnectedness of career and life satisfaction. Post-World War II, the field saw significant growth due to the need for psychological support for returning veterans and their families. The establishment of professional organizations and the development of standardized training programs further solidified counseling as a distinct profession. Key figures like Carl Rogers and Abraham Maslow introduced humanistic approaches, emphasizing client-centered care and self-actualization. These historical developments laid the foundation for modern counseling practices. Understanding this evolution helps contextualize current theories and methodologies. The mid to late 20th century witnessed the diversification of counseling into various specializations, including school counseling, rehabilitation counseling, and mental health counseling. Legislative acts and public awareness campaigns also played a crucial role in destigmatizing mental health issues and increasing access to services. The integration of research and evidence-based practices became paramount, leading to more effective and accountable interventions. Today, mental health counseling continues to evolve, incorporating new technologies, addressing diverse cultural needs, and responding to emerging global challenges. This ongoing development reflects the profession's commitment to adapting and improving client care. The historical journey underscores the dynamic nature of the field. Ethical principles in counseling. Ethical principles form the bedrock of professional mental health counseling, guiding practitioners in their decision-making and conduct. These principles ensure client welfare, maintain professional integrity, and foster public trust. Core ethical principles include autonomy, which respects the client's right to self-determination and independent decision-making. Non-maleficence dictates that counselors must do no harm to their clients, actively avoiding actions that could cause injury or distress. Beneficence compels counselors to act in the best interests of their clients, promoting their well-being and growth. Justice requires fair and equitable treatment for all clients, regardless of background or circumstance. Fidelity involves honoring commitments and maintaining trustworthiness in the therapeutic relationship. These principles are often codified in professional codes of ethics. Veracity, the principle of honesty, is also crucial, requiring counselors to be truthful with clients, though this must be balanced with other ethical considerations like non-maleficence. Ethical decision-making models provide a structured approach for counselors to navigate complex dilemmas, considering all relevant principles and potential consequences. These models typically involve identifying the problem, applying ethical codes, considering moral principles, generating potential courses of action, and evaluating the chosen solution. Regular consultation with supervisors and peers is an essential component of ethical practice, offering diverse perspectives and accountability. Adherence to these principles is not merely a legal requirement, but a fundamental commitment to responsible and compassionate care. Legal aspects and confidentiality. Legal aspects are critical in mental health counseling, dictating the boundaries and responsibilities of practitioners. Counselors must be well versed in state and federal laws that govern their practice, including licensure requirements, scope of practice, and reporting mandates. Ignorance of these laws does not excuse non-compliance and can lead to severe professional consequences. Key legal considerations often include informed consent, which ensures clients understand the nature of therapy, its potential risks and benefits, and their rights. Documentation standards are also legally mandated, requiring accurate and timely record-keeping of client interactions and treatment plans. Adherence to these legal frameworks protects both the client and the counselor. Maintaining legal compliance is an ongoing professional responsibility. Confidentiality is a cornerstone of the therapeutic relationship, legally and ethically protecting client information. It fosters trust and allows clients to share sensitive details without fear of disclosure. However, confidentiality is not absolute. There are specific legal exceptions where counselors are mandated to break it. These exceptions typically include situations where a client poses a serious and imminent danger to themselves or others, or when there is suspected child or elder abuse. Counselors are also legally required to release information if compelled by a court order. It is crucial for counselors to clearly explain the limits of confidentiality to clients during the informed consent process. Navigating these legal and ethical boundaries requires careful judgment and a thorough understanding of applicable laws and professional guidelines. Counseling theories. Psychodynamic theories, originating from Sigmund Freud's psychoanalysis, emphasize the influence of unconscious processes, early childhood experiences, and unresolved conflicts on current behavior and mental health. This approach posits that psychological problems stem from repressed emotions and traumatic experiences stored in the unconscious mind. Therapy aims to bring these unconscious elements into conscious awareness, allowing clients to gain insight and resolve past conflicts. Key concepts include the id, ego, and superego, defense mechanisms, and transference. The therapeutic relationship is central, with the counselor often interpreting client behaviors and dreams to uncover hidden meanings. While traditional psychoanalysis is long-term, modern psychodynamic therapy is often briefer and more focused. Understanding these foundational theories provides a historical and conceptual basis for contemporary practice. Techniques used in psychodynamic therapy often include free association, where clients verbalize whatever comes to mind without censorship, to access unconscious thoughts. Dream analysis is another method, interpreting the symbolic content of dreams to reveal hidden desires and conflicts. Transference, the client's unconscious redirection of feelings from a significant person in their past to the therapist, is actively explored. Countertransference, the therapist's emotional reaction to the client, is also recognized and managed. The goal is to help clients understand how their past influences their present, leading to greater self-awareness and healthier coping strategies. This approach can be particularly effective for clients with long-standing patterns of behavior or deep-seated emotional issues. Counseling theories. Cognitive behavioral therapy is a highly structured and goal-oriented approach that focuses on the interplay between thoughts, feelings, and behaviors. It operates on the premise that maladaptive thought patterns and learned behaviors contribute to psychological distress. CBT helps clients identify and challenge irrational or negative automatic thoughts, known as cognitive distortions, which often lead to emotional problems. By modifying these thought patterns, clients can change their emotional responses and behaviors. This therapy is typically short-term and present-focused, addressing current problems rather than extensively exploring past experiences. It is widely researched and has demonstrated effectiveness for a broad range of mental health conditions. Clients are actively involved in their treatment, often completing homework assignments between sessions. Counseling theories. Humanistic. Humanistic counseling theories, including person-centered therapy developed by Carl Rogers, emphasize the inherent goodness and potential for growth within every individual. This approach views clients as experts on their own lives, capable of self-direction and self-actualization. The therapist's role is not to direct or interpret, but to create a warm, supportive, and non-judgmental environment where clients can explore their feelings and discover their own solutions. Key concepts include unconditional positive regard, empathy, and congruence, genuineness from the therapist. These core conditions are believed to foster a therapeutic climate conducive to client growth. Humanistic therapy focuses on the present moment and the client's subjective experience. It is a powerful approach for fostering self-esteem and personal responsibility. In humanistic therapy, the counselor strives to understand the client's world from their perspective, offering deep, accurate empathy. Unconditional positive regard means accepting and valuing the client completely, without judgment, regardless of their thoughts or behaviors. Congruence involves the therapist being authentic and transparent in the relationship, sharing their genuine feelings when appropriate. These conditions create a safe space for clients to explore their true selves, reconcile discrepancies between their ideal and real selves, and move towards greater self-acceptance. The focus is on facilitating the client's natural tendency towards growth and fulfillment. This non-directive approach empowers clients to take ownership of their therapeutic journey and personal development. Counseling theories. Family systems. Family systems theory views individuals not in isolation, but as integral parts of their family unit, which is seen as an interconnected system. Problems experienced by an individual are often understood as symptoms of dysfunction within the larger family system. This approach emphasizes understanding the patterns of interaction, communication, and roles within a family. It recognizes that changes in one part of the system affect all other parts. Key concepts include boundaries, alliances, triangles, and identified patient. Therapy aims to identify and modify maladaptive family patterns rather than focusing solely on the individual's symptoms. This holistic perspective offers powerful insights into complex relational dynamics. It shifts blame from individuals to systemic issues. Techniques in family systems counseling often involve mapping family structures, such as genograms, to visualize intergenerational patterns and relationships. Therapists may use reframing to help family members see problems from a different perspective, reducing blame and fostering empathy. Circular questioning is employed to explore how each family member perceives the problem and its impact on others, highlighting interconnectedness. Boundary work helps families establish healthier limits between members and subsystems. The goal is to improve communication, strengthen relationships, and create a more functional and supportive family environment. This approach is particularly effective for issues like marital conflict, parent-child problems, and substance abuse within a family context. Assessment and diagnosis in counseling. Assessment and diagnosis are fundamental processes in mental health counseling, providing a structured way to understand a client's presenting concerns and guide treatment planning. Assessment involves gathering comprehensive information about a client's history, symptoms, strengths, and environmental factors. This process often utilizes various tools, including clinical interviews, standardized psychological tests, behavioral observations, and self-report measures. The goal is to develop a holistic picture of the client's functioning. Accurate assessment helps counselors formulate an appropriate diagnosis, which is a classification of mental health conditions based on established criteria. This initial phase is crucial for tailoring interventions effectively. It ensures that treatment is targeted and evidence-based. Diagnosis, while essential for communication among professionals and for insurance purposes, must be approached with caution and cultural sensitivity. Counselors use diagnostic manuals, primarily the Diagnostic and Statistical Manual of Mental Disorders, DSM-5-TR, to classify mental health conditions. It is important to remember that a diagnosis describes a set of symptoms and not the entirety of a person. Counselors must avoid labeling clients and instead focus on understanding the individual's unique experience. Ethical considerations such as avoiding misdiagnosis and understanding the potential impact of a label are paramount. The assessment and diagnostic process is ongoing, with counselors continually evaluating client progress and adjusting their understanding as new information emerges. This dynamic approach ensures flexible and responsive care. DSM-5-TR Overview and Application. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, DSM-5-TR, is the standard classification of mental disorders used by mental health professionals in the United States. It provides a common language and standardized criteria for the classification of mental disorders. The DSM-5-TR organizes disorders into categories based on shared features and diagnostic criteria, aiding in reliable diagnosis and treatment planning. It also includes information on prevalence, risk, and prognostic factors, culture-related diagnostic issues, and differential diagnoses. Counselors utilize the DSM-5-TR to understand client symptoms within a broader diagnostic framework, facilitating communication with other healthcare providers and insurance companies. While a crucial tool, it is important to use it judiciously and not as the sole determinant of a client's identity or treatment needs. Applying the DSM-5-TR requires careful clinical judgment and a thorough understanding of its guidelines. Counselors must conduct comprehensive assessments to gather sufficient information to meet diagnostic criteria, considering symptom duration, severity, and functional impairment. It is essential to rule out other medical conditions or substance use that might mimic mental health symptoms. The DSM-5-TR also emphasizes the importance of cultural context in diagnosis, urging clinicians to consider how cultural factors may influence symptom presentation and interpretation. Counselors should be aware of the potential for misdiagnosis and the stigmatizing effects of labels. Therefore, diagnosis is an ongoing, dynamic process that integrates diagnostic criteria with a holistic understanding of the client's unique life circumstances and strengths, ensuring person-centered care. Treatment planning and goal setting. Treatment planning is a collaborative and dynamic process between the counselor and client, outlining the roadmap for therapeutic intervention. It involves identifying the client's primary concerns, establishing measurable goals, and selecting appropriate strategies to achieve those goals. A well-constructed treatment plan provides structure, direction, and a means to track progress throughout therapy. It typically includes a diagnostic summary, long-term and short-term goals, specific objectives, and proposed interventions. The plan should be individualized, reflecting the client's unique needs, strengths, and cultural background. Regular review and modification of the treatment plan are essential to ensure its continued relevance and effectiveness. This iterative process ensures that therapy remains client-centered and responsive. Goal setting is a critical component of treatment planning, providing clear targets for therapeutic work. Goals should be SMART, specific, measurable, achievable, relevant, and time-bound. Long-term goals represent the ultimate desired outcomes, while short-term objectives are smaller, incremental steps that contribute to achieving the long-term vision. For example, a long-term goal might be reduce symptoms of anxiety, with short-term objectives like learn 3 relaxation techniques or challenge negative thoughts daily. Clients' active involvement in setting goals increases their commitment and motivation. Counselors help clients break down overwhelming goals into manageable steps, fostering a sense of accomplishment and progress. Effective goal setting empowers clients and provides a clear framework for therapeutic success. Crisis intervention techniques. Crisis intervention is a short-term, immediate response to help individuals in acute psychological distress regain emotional equilibrium and cope with overwhelming events. It is not long-term therapy, but rather a focused, time-limited intervention aimed at stabilizing the client and ensuring their safety. Crises can stem from various sources, including natural disasters, personal trauma, sudden loss, or severe mental health episodes. The primary goals are to provide immediate support, assess the client's level of risk, especially for self-harm or harm to others, and connects them with appropriate resources. Counselors must act quickly and decisively, demonstrating empathy and calm under pressure. Effective crisis intervention can prevent further deterioration and facilitate recovery. Key techniques in crisis intervention include establishing rapport quickly, actively listening to the client's story, and validating their feelings. Counselors perform a rapid assessment of the client's current situation, including their support system, coping mechanisms, and any immediate safety concerns. They help clients identify and prioritize immediate needs, offering practical assistance and problem-solving strategies. Psychoeducation about common crisis reactions can normalize the client's experience and reduce feelings of isolation. Developing a safety plan, if necessary, is paramount, outlining steps the client can take to ensure their well-being. Finally, linking clients to ongoing support, such as therapy, medical care, or community resources, is crucial for long-term recovery. The ability to remain composed and directive is vital in these high-stakes situations. Trauma-informed care. Trauma-informed care is an approach that recognizes the widespread impact of trauma and understands potential paths for recovery. It integrates knowledge about trauma into all aspects of service delivery, shifting the focus from what's wrong with you to what happened to you. This framework acknowledges that many clients seeking mental health services have experienced trauma, which can significantly influence their behavior, relationships, and overall well-being. The core principles of trauma-informed care include safety, trustworthiness, peer support, collaboration, empowerment, and cultural, historical, and gender issues. It aims to avoid re-traumatization and create environments where clients feel secure and respected. This approach fundamentally changes how services are delivered. Implementing trauma-informed care involves several key practices. Counselors prioritize creating a physically and emotionally safe environment for clients, ensuring predictability and transparency in interactions. Building trustworthiness is paramount, requiring clear communication, consistent boundaries, and honoring commitments. Peer support, where individuals with lived experience offer guidance, is often integrated. Collaboration and mutuality emphasize shared decision-making and power sharing between clients and providers. Empowering clients involves recognizing their strengths, fostering self-advocacy, and supporting their choices. Finally, addressing cultural, historical, and gender-based trauma acknowledges the unique experiences and systemic factors that impact individuals. By adopting these principles, counselors can provide more effective, respectful, and healing services to individuals affected by trauma. Substance use disorders counseling. Substance use disorders, SUDs, counseling addresses the complex challenges associated with addiction to alcohol, drugs, or other substances. It involves a comprehensive approach to help individuals achieve and maintain sobriety, improve their overall functioning, and prevent relapse. Counselors specializing in SUDs understand the biological, psychological, social, and spiritual dimensions of addiction. They work with clients to explore the root causes of their substance use, develop coping strategies, and rebuild healthy relationships. The goal is not just abstinence, but also a fundamental shift in lifestyle and perspective. This specialized area requires specific knowledge of addiction science and effective intervention models. It is a field demanding both expertise and compassion. Effective SUDS counseling often integrates various therapeutic modalities, including motivational interviewing, which helps clients explore and resolve ambivalence about change. Cognitive behavioral therapy, CBT techniques, are used to identify and modify thought patterns and behaviors contributing to substance use. Group counseling provides a supportive environment for clients to share experiences and learn from peers. Family therapy may be incorporated to address systemic issues and improve family dynamics. Relapse prevention strategies are crucial, teaching clients to identify triggers, develop coping plans, and manage cravings. Counselors also facilitate connections to community resources, such as 12-step programs and support groups. A non-judgmental, empathetic stance is vital for building rapport and fostering client engagement in the recovery process. Grief and loss counseling. Grief and loss counseling provides support to individuals experiencing the profound emotional and psychological impact of loss. Loss can manifest in various forms, including the death of a loved one, the end of a relationship, job loss, health decline, or significant life transitions. This specialized counseling helps clients navigate the complex and often overwhelming emotions associated with grief, such as sadness, anger, guilt, and confusion. It acknowledges that grief is a highly individualized process with no fixed timeline or prescribed stages. The counselor's role is to create a safe space for clients to express their feelings, process their experiences, and find healthy ways to adapt to their new reality. It is a compassionate and empathetic form of support. Key interventions in grief and loss counseling include validating the client's experience and normalizing their grief reactions. Counselors help clients explore their relationship with the deceased or lost entity, allowing for remembrance and meaning-making. They assist in identifying and processing complicated grief, which may involve prolonged or debilitating symptoms. Techniques such as narrative therapy can help clients construct new narratives around their loss, integrating it into their life story. Support for developing coping strategies, managing triggers, and rebuilding a sense of purpose is also crucial. The goal is not to get over the loss, but to learn to live with it in a way that honors the past while moving forward. This process fosters resilience and continued connection. Child and adolescent counseling. Child and adolescent counseling is a specialized area that addresses the unique developmental, emotional, and behavioral challenges faced by younger clients. Counselors working with children and adolescents must understand child development, family dynamics, and the impact of school and peer relationships. Interventions are often adapted to be age-appropriate, utilizing play therapy for younger children and more verbal or creative approaches for adolescents. The goal is to help young clients develop healthy coping skills, improve communication, resolve conflicts, and navigate developmental transitions. Collaboration with parents, guardians, and school personnel is often a critical component of successful treatment. This field requires patience, creativity, and a deep understanding of youth psychology. Techniques in child and adolescent counseling vary widely based on age and presenting issues. For young children, play therapy allows them to express feelings and process experiences through toys and creative activities. Art therapy and sand play can also be effective non-verbal modalities. For adolescents, individual talk therapy, often incorporating CBT or psychodynamic principles, is common. Group therapy can address social skills, peer pressure, and self-esteem. Family therapy is frequently used to improve communication and resolve conflicts within the family unit. Counselors also provide psychoeducation to parents on effective parenting strategies and child development. Building a trusting and respectful relationship with the young client is paramount, ensuring they feel heard and understood in a safe environment. Couples and family counseling. Couples and family counseling focuses on improving relationships and resolving conflicts within romantic partnerships and family units. This approach views relational problems as systemic, meaning that issues arise from interaction patterns rather than solely from individual pathology. Counselors work with all members of the system, facilitating communication, fostering empathy, and identifying dysfunctional patterns. The goal is to enhance understanding, strengthen bonds, and develop healthier ways of relating to one another. This type of counseling can address a wide range of issues, including communication breakdowns, infidelity, parenting challenges, blended family dynamics, and significant life transitions. It requires the counselor to remain neutral and facilitate open dialogue among all participants. Key techniques in couples and family counseling include active listening and reflective communication, where the counselor models and teaches effective ways for members to hear and understand each other. Identifying and challenging negative interaction cycles is crucial, helping families break free from repetitive, unhelpful patterns. Emotionally focused therapy, EFT, helps couples understand underlying attachment needs and express emotions more effectively. Structural family therapy focuses on reorganizing family hierarchies and boundaries to create a more functional structure. Psychoeducation on communication skills, conflict resolution, and healthy relationship dynamics is also provided. The counselor acts as a facilitator, guiding the family or couple towards greater insight and more constructive ways of interacting, ultimately fostering stronger, more resilient relationships. Group counseling dynamics. Group counseling involves a small number of individuals meeting regularly with a trained counselor to address shared concerns and achieve personal growth. The group setting provides the unique therapeutic environment where members can offer mutual support, share experiences, and receive diverse perspectives. Group dynamics, including cohesion, communication patterns, and roles, play a significant role in the therapeutic process. The counselor acts as a facilitator, guiding discussions, ensuring a safe and respectful environment, and managing group interactions. Benefits of group counseling include reduced feelings of isolation, increased self-awareness through feedback, and the opportunity to practice new behaviors in a supportive setting. It is a powerful modality for fostering connection and change. Key stages of group development typically include forming, storming, norming, performing, and adjourning. In the forming stage, members are often cautious and dependent on the leader. Storming involves conflict and testing boundaries as members establish their roles. Norming sees the development of group cohesion and shared norms. Performing is when the group works effectively towards its goals, offering support and feedback. Finally, adjourning involves the termination of the group and processing of goodbyes. The counselor's role evolves through these stages, from more directive in the early phases to more facilitative as the group matures. Ethical considerations, such as confidentiality within the group and managing challenging behaviors, are paramount. Understanding these dynamics is crucial for effective group facilitation. Cultural competence in counseling. Cultural competence in counseling is the ability of counselors to understand, appreciate, and effectively interact with people from cultures and belief systems different from their own. It involves recognizing one's own cultural biases and assumptions, and actively working to overcome them. This competence is not a destination, but an ongoing process of self-reflection, learning, and adaptation. Culturally competent counselors acknowledge that culture shapes clients' worldviews, communication styles, coping mechanisms, and help-seeking behaviors. Failing to consider cultural factors can lead to misdiagnosis, ineffective interventions, and a breakdown of the therapeutic relationship. It is an ethical imperative to provide culturally sensitive and appropriate care to all clients. This commitment enhances the effectiveness and inclusivity of counseling services. Developing cultural competence involves several key components. Counselors must cultivate cultural self-awareness, understanding their own cultural background and how it influences their perspectives. Cultural knowledge involves learning about the history, values, beliefs, and practices of diverse client populations. This includes understanding the impact of systemic oppression, discrimination, and historical trauma on marginalized groups. Cultural empathy requires the ability to understand and share the feelings of another person from their cultural perspective. Finally, cultural skills involve adapting counseling techniques and interventions to be culturally appropriate and effective. This might include using culturally relevant metaphors, involving family members in therapy, or understanding nonverbal communication differences. Continuous education, consultation, and engagement with diverse communities are essential for ongoing development in this critical area. Diversity and inclusion in practice. Diversity and inclusion are paramount in mental health counseling, ensuring that all clients feel seen, valued, and understood, regardless of their background. Diversity encompasses a wide range of human differences, including race, ethnicity, gender, sexual orientation, socioeconomic status, religion, age, ability, and national origin. Inclusion involves actively creating an environment where these diverse individuals feel welcome, respected, and empowered to participate fully. Counselors must recognize and address systemic inequalities and biases that impact marginalized communities. Providing inclusive care means adapting practices to meet the unique needs of each client, challenging stereotypes, and advocating for social justice. This commitment goes beyond cultural competence to actively dismantle barriers and promote equity. Practicing diversity and inclusion means counselors actively engage in anti-racist and anti-oppressive practices. This involves continuous self-reflection on one's own privileges and biases and seeking education on the experiences of marginalized groups. Counselors advocate for clients who face discrimination and work to challenge discriminatory policies within institutions. They ensure that their counseling environment is physically and psychologically accessible to all. Using inclusive language, respecting pronouns, and understanding diverse family structures are also crucial. Furthermore, counselors must be aware of how intersectionality, the interconnected nature of social categorizations like race, class, and gender, creates overlapping and interdependent systems of discrimination or disadvantage. By embracing diversity and inclusion, counselors foster more equitable, effective, and empowering therapeutic relationships for all clients. Professional identity and development. Developing a strong professional identity is crucial for mental health counselors. Defining their role, values, and ethical responsibilities within the broader healthcare system. This identity is shaped through education, training, supervision, and practical experience. It involves understanding the unique contributions of counseling as a profession, distinct from psychology, social work, or psychiatry. A clear professional identity fosters confidence, competence, and a sense of belonging within the counseling community. It also guides counselors in advocating for their profession and their clients. This ongoing process of self-definition helps counselors navigate complex professional landscapes and maintain integrity in their practice. It is a continuous journey of growth and refinement. Professional development is an ongoing commitment for mental health counselors, ensuring they remain current with best practices, new research, and evolving ethical guidelines. This includes pursuing continuing education units, CEUs, attending workshops and conferences, engaging in supervision, and participating in professional organizations. Specialization in particular areas, such as trauma, addiction, or couples counseling, further refines a counselor's expertise. Reflective practice, where counselors critically examine their own work and its impact, is also vital for growth. Maintaining a strong professional identity and engaging in continuous development not only benefits the counselor, but also ensures the highest quality of care for clients. It reflects a dedication to lifelong learning and excellence in the field. Supervision and consultation. Supervision is a cornerstone of professional mental health counseling, providing a structured relationship where a less experienced counselor, supervisee, receives guidance and feedback from a more experienced qualified supervisor. Its primary purposes are to ensure client welfare, promote the supervisee's professional development, and gatekeep the profession. Supervisors offer clinical insights, help supervisees navigate ethical dilemmas, and enhance their therapeutic skills. This process is mandatory for licensure and ongoing professional growth, fostering competence and accountability. Supervision creates a safe space for supervisees to reflect on their cases, explore countertransference, and receive support. It is a critical component for maintaining high standards of care and preventing burnout. The supervisory relationship is built on trust and mutual respect. Consultation, while related to supervision, typically involves seeking expert advice on a specific case or professional issue from a colleague or specialist, without the formal ongoing evaluative component of supervision. Counselors engage in consultation to gain new perspectives, troubleshoot challenging situations, or ensure they are providing the best possible care. Both supervision and consultation are ethical imperatives, ensuring that counselors do not practice in isolation and have access to external support and expertise. They help counselors maintain objectivity, prevent ethical breaches, and continuously refine their practice. Regular engagement in both processes is indicative of a committed and responsible mental health professional. These practices are essential for lifelong learning and ethical practice. Research and evidence-based practice. Research and evidence-based practice, EBP, are essential for effective mental health counseling, ensuring that interventions are supported by scientific evidence. EBP integrates the best available research evidence with clinical expertise and client values, preferences. Counselors are expected to stay informed about current research findings and apply them judiciously in their practice. This involves critically evaluating research studies, understanding statistical significance, and discerning the applicability of findings to diverse client populations. Engaging in EBP enhances treatment effectiveness, improves client outcomes, and promotes accountability within the profession. It moves counseling beyond intuition to a more systematic and data-driven approach. This commitment to evidence ensures the highest quality of care. Implementing EBP involves a continuous cycle of inquiry. Counselors first formulate answerable clinical questions about client care. Then, they search for the best available research evidence, often through academic databases and professional journals. Critically appraising the evidence involves evaluating the quality, validity, and applicability of research studies. Integrating this evidence with their own clinical expertise, knowledge of client characteristics, and client preferences is the next step. Finally, counselors evaluate the outcomes of their interventions and adjust their practice accordingly. This iterative process ensures that counseling remains dynamic, responsive, and grounded in scientific rigor. It is a commitment to continuous learning and improvement, ultimately benefiting clients by providing the most effective treatments available. Wellness and self-care for counselors. Wellness and self-care are not luxuries, but ethical imperatives for mental health counselors. The demanding nature of the profession, involving exposure to client trauma and emotional distress, can lead to burnout, compassion fatigue, and secondary traumatic stress. Prioritizing self-care ensures counselors maintain their own mental and physical health, which directly impacts their ability to provide effective and ethical care. A counselor who is well-rested, emotionally regulated, and physically healthy is better equipped to be present and empathetic with clients. Self-care involves intentional activities that promote well-being across various dimensions, including physical, emotional, social, spiritual, and intellectual. It is a proactive strategy to sustain professional longevity and personal fulfillment. Effective self-care strategies are highly individualized, but often include practices such as regular exercise, adequate sleep, healthy nutrition, and mindfulness or meditation. Engaging in hobbies, spending time in nature, and maintaining a strong social support system are also crucial for emotional replenishment. Counselors should establish clear boundaries between their professional and personal lives to prevent work from encroaching on personal time. Seeking personal therapy or supervision when needed is another vital aspect of self-care, providing a safe space for processing professional challenges. By modeling healthy self-care practices, counselors also implicitly teach their clients the importance of prioritizing their own well-being. This commitment to self-care is a continuous process, adapting to changing personal and professional needs. Career development and licensure. Career development for mental health counselors involves a structured path from education and training to licensure and ongoing professional growth. After completing a master's or doctoral degree in counseling, aspiring counselors typically enter a supervised clinical experience phase, accumulating thousands of hours under the guidance of a qualified supervisor. This supervised practice is crucial for developing practical skills and integrating theoretical knowledge. Licensure, granted by state boards, signifies that a counselor has met specific educational, experiential, and examination requirements, demonstrating competence to practice independently. The specific requirements vary significantly by state, necessitating careful research and planning. Understanding this pathway is essential for anyone pursuing a career in mental health counseling. Once licensed, counselors must engage in continuous professional development to maintain their license and enhance their expertise. This often includes completing continuing education units, CEUs, regularly, participating in professional organizations, and seeking advanced certifications in specialized areas. Career opportunities for licensed mental health counselors are diverse, ranging from private practice and community mental health centers to hospitals, schools, and government agencies. Networking, mentorship, and strategic career planning are vital for navigating the professional landscape and achieving long-term career satisfaction. The field offers immense opportunities for making a positive impact on individuals and communities, making the journey through education and licensure a rewarding investment. Future trends in mental health. The field of mental health counseling is continuously evolving, with several key trends shaping its future. One significant trend is the increasing integration of technology, including telehealth, artificial intelligence, AI, and virtual reality, VR, in therapeutic interventions. Telehealth has expanded access to care, particularly in underserved areas, and is likely to remain a prominent mode of service delivery. AI-powered tools may assist in diagnosis, treatment planning, and even deliver certain interventions, though human oversight remains crucial. VR is being explored for exposure therapy and skill building in immersive environments. These technological advancements promise to revolutionize how mental health services are accessed and delivered. They offer new possibilities for reaching more people and enhancing treatment effectiveness. Another major trend is the growing emphasis on preventative mental health and early intervention, shifting from a reactive to a proactive approach. There is also an increasing focus on holistic and integrative care, recognizing the interconnectedness of mind, body, and spirit. This includes incorporating practices like mindfulness, nutrition, and physical activity into treatment plans. Furthermore, the demand for culturally responsive and inclusive care will continue to grow, requiring counselors to deepen their understanding of diverse populations and address systemic inequities. The profession will also see continued specialization, with counselors developing expertise in niche areas. These trends underscore a future where mental health counseling is more accessible, personalized, and integrated into overall well-being. The future holds exciting possibilities for innovation and impact.